Well, hello and welcome back to the Alliance Against Seclusion and Restraint live series. My name is Guy Stevens, and I just noticed we're having a slight issue here on Facebook. So, Courtney, if you can help me out with that behind the scenes. It looks like our connection for some reason on Facebook has broken, but we'll get that fixed here in one moment. You are here for a special episode of our podcast, and we've been actually doing a lot of special episodes lately. And I guess that's a good thing. It means that there's a lot of things going on in the world that we think are worth adding special episodes for, and today is no exception to that. We're going to be sharing something really exciting with you today. If this is your first time here, welcome. If it's not your first time here, welcome back. It's always great to have so many people that come to these podcasts that we do week after week, and always love seeing new people joining us for the first time. It's great to have people that are exploring our work and trying to learn more about the things that we're doing. If you're not familiar with the Alliance Against Seclusion and Restraint, we are a small nonprofit. We are located in Maryland, but we actually work across the country and across the world, quite frankly, doing work to try to move people away from punitive and exclusionary discipline, things like restraint and seclusion and suspension and expulsion and corporal punishment. More broadly, all the things that are often done to kids in the name of behavior. So we are out there trying to change laws and policies and educate people on better ways to support children, better ways to really bring about change. And of course, if you follow us, you know that we often talk about what I call the 5 principles. The 5 principles are kind of what we think is a better way. It's about trauma-informed, neuroscience-aligned, neurodiversity-affirming, relationship-driven, and collaborative approaches. So as I mentioned, today is a special episode. And a special episode means that, we typically are here every other week. And when we have special things we want to talk about, we sometimes come back in on that alternate week here. And today is a really good reason to do that. So we've got some research that we're going to be sharing with you from someone who was an intern here at the Alliance Against Seclusion and Restraint, Sukhu, and has done some really interesting research that I think is really meaningful. And for the work that we do here at the Alliance, I really want to share and amplify all the amazing work that's being done out there. And I love that, we've got students out there working in universities across the country that are finding the work that we're doing here at the Alliance and are incorporating it into the research that they're doing. And that's really exciting. So just share with you that, this will be, I think, a really great discussion today. I did want to mention before we get up here with our guest, if you are a supporter of our work, it's really important that you help us to continue to do what we're doing here. And as a small nonprofit, of course, we rely on support from our community. We get some grant funding and other things that we're able to do as well. But support from our community is really important. And if you are in a position that you're able to, I would encourage you to think about joining the Alliance. If you go to our website, which is endseclusion.org, there's an option there to join the Alliance. And what you can do there is you can become a member. By becoming a member, you agree to make a small monthly donation. They start around $5 a month. And when you make a monthly donation, it helps to support the work that we're doing. Different membership levels actually have different benefits as well, from discounts on some of the educational products that we do and things like that as well. So if you're able, please consider supporting our work. It's really important to help us continue to do the things that we are doing here. So with that, let's go ahead and bring our guest up here on the stage. And I'm going to read a short bio here. Hey, Lauren. So I'm going to read a short bio here to tell folks who you are. And Lauren Sukhu from Dallas graduated from the University of Texas at Austin with a B.S.A. in biology, a minor in Hindi, and a certificate in evidence and inquiry. A member of the Polymathic Scholars Honors program, she conducted research at the Dell Medical School on excessive school discipline practices, including restraint and seclusion, serving as a project manager for the Restraint and Seclusion Initiative in the lab of Dr. Micky Marinelli. Her honors thesis, and that's what we're here to talk about today, Leveling the Playing Field in School Safety, examines the inequities in school discipline policies. She was also an intern at the Alliance Against Seclusion and Restraint. Lauren was actively involved in a project that we were doing here, looking at the psychological impact of the use of restraint and seclusion. You've also been involved on campus as a peer mentor in the Bioprospecting stream of the Freshman Research Initiative, a program assistant for women in STEM, and a volunteer at Dell Children's Medical Center. She's also played the viola in Engineering Chamber Orchestra, and your work has earned you a Distinguished College Scholar Award and the College Scholar Award. After graduation, you are going to be, and you have graduated, attending Texas A&M College of Medicine to pursue an MD. Great to have you here today, Lauren. I'm really excited to have you and have you share the research that you did with our audience here at the Alliance.
Thank you. I'm very excited to be here.
And I've had the good fortune of knowing you for some time now, and I'm trying to remember when you first started, volunteering and interning as an intern with the Alliance. When was that? Do you recall?
I think it was about August, September 2024.
Okay. Yeah, I knew it had been a while. I mean, it's been a good 2 years. And you developed work, kind of an interest around restraint and seclusion and discipline. Tell me a little bit more about that, how you first, because restraint and seclusion are something that a lot of people don't know anything about at all, and you develop this interest in it. So tell me a little bit about how you became interested in the topic of restraint and seclusion.
Yeah, definitely. So I was looking to pursue research while I was at the University of Texas at Austin. And so I was reaching out to people, seeing if they had any space in their lab. And Dr. Marinelli wrote me back, and she said, I don't have space in the project that you inquired about, but I have space in this project looking at restraint and seclusion. And so I was like, I don't know what restraint and seclusion is, but I'm willing to learn, and I would really like to help out on this research project. And so I joined, and I started out just reading research papers, reading all the media, watching the Alliance podcasts, and I began to kind of understand a little bit more about what restraint and seclusion is and what we can do to prevent it, what media literacy there should be, what policies there should be. And so by going into the lab, it kind of interested me, and it kind of piqued my interest about restraint and seclusion, made me want to work on this.
Yeah, that's great. And what do you recall? I'll tell you from my personal experience that, I got involved in this area because of experience that my son had. And I'll be honest with you, the first time I really heard about restraint and seclusion in the context of school, I was actually pretty surprised, because the idea that kids might be physically restrained or secluded in a school would never have crossed my mind. Do you recall, as you began to kind of dive into this as a topic, what your initial thoughts were?
Definitely. So specifically for seclusion, my first thought was, okay, that's timeout. And then I began to read more about it, and I was like, okay, this is not timeout. This is significantly worse, and this is something totally different. And so when I first heard about it, I was initially kind of confused and then very shocked once I was realizing what was going on and how it was disproportionately happening to certain demographics and how it was happening to kids in schools. I don't think I really knew that it was happening at all. And so I was very shocked to learn about it and how much it really was happening, especially under the scenes.
Yeah, absolutely. Yeah, I mean, it really is shocking. And again, I mean, when you think about, okay, well, there's a timeout, but then you're like, well, no, this isn't that. This is somebody being forced into a room against their will while somebody on the outside holds a door shut. And, I know that, you got involved actually in a project that we were working on called the Psychological Impact Project, where we were looking at specifically trying to understand what the impact was of the use of restraint and seclusion. And of course, that led to a survey that went out, and that research is still kind of in progress. But would you mind telling us a little bit about how you got involved in that and kind of what you may have learned? I mean, I realize it's still kind of a work in progress, but what did you learn from your experience in that?
Definitely. So in my research at Dr. Marinelli's lab, I made a video kind of about restraint and seclusion, and then she emailed it to the Alliance, and then the Alliance posted it on Facebook. And at this point, I'd only watched your podcast. I would follow you guys on Facebook. And so I was freaking out. I was like, oh my gosh, they know who I am. This is insane. And so then I wrote to you guys, and I was like, I would love to be a volunteer. I would love to be an intern. I would love to get involved. And so from that point in time, we met, and then you explained that there was an opening in this project that you were looking into it. And so the first step was for us to kind of identify what the project was, and we kind of build a research question. And so we realized we wanted to look at the psychological impact that restraint and seclusion has as people grow up. So we're looking at adults who have experienced restraint and seclusion as a child. How does that psychologically impact them as an adult? And so once we kind of narrowed down the research question, we realized what questions we wanted to ask. We then did an IRB, and then we sent out a survey. And now we're in the process of analyzing the survey results. We just closed that survey a little while ago. So we're analyzing all the results that we've gotten about people who have experienced restraint and seclusion as a child and are now currently adults.
Yeah, really, really important research. When I first began doing this work, and one of the things that kind of surprised me is I learned more about the use of seclusion and restraint. I had little doubt that for a young child, and if you look at the data, kids that are more often restrained and secluded are often very young children. Generally, children with disabilities are more likely. Black or brown children far more likely to be restrained and secluded. But if you begin to look at that data, one of the things that seemed like a pretty safe conclusion was, gosh, this is probably really traumatic for kids if they're physically restrained or secluded. But one of the things that I began to learn was that people would question that. People would say, well, where's the evidence that shows that physically restraining a child or secluding them would be traumatic? And of course, for me, it's hard to imagine somebody questioning that. It's hard to imagine the idea that holding a child down in some way against their will or forcing them into a room and not letting them out, that anyone would question whether that was traumatic. But the truth of the matter is that people did. And, there were gaps. There wasn't research really talking about the impact, probably for a lot of reasons. I mean, one, you wouldn't do these things to only measure the impact. So there certainly was a gap there in terms of research. So this project, I think was really exciting to begin doing that. Of course, as I mentioned to you, as we were getting ready to start here, we're actually getting ready to start another research project related to this as well. But I think it's really important because understanding the impact of these things can help affect changes in laws and policies to move people away from these things. So, that was one project. Then, of course, throughout your degree in your program, you continued to have an interest in this idea of kind of punitive and exclusionary discipline, ultimately, writing a paper here. And I wonder, and I'm actually going to bring this up, I'm going to bring up an article you wrote for us, and we'll share your paper as well. But you ended up writing an article saying leveling the playing field in school safety. National data reveals who's most harmed by restraint, seclusion, and corporal punishment. So tell me a little bit about how this came to be, how you ended up, writing this research piece on restraint, seclusion, and corporal punishment.
Definitely. So as mentioned before, I'm in the Polymathic Scholars Honors program. And so as part of the honors program, you basically pick a topic and then you write some sort of honors thesis about this topic. And so I was in Dr. Marinelli's lab on restraint and seclusion. So I knew that whatever I wrote, I knew I wanted it to be about restraint and seclusion. Whether it's how often it happens, psychological impact, I knew I wanted the main topic to be restraint and seclusion. So I was doing some digging online about data, and the CRDC, which is a government program, basically publishes online restraint, seclusion, and corporal punishment data. And so I was looking through the government data, and then I started to look through the government analysis of the data. And at this point in time, I was a sophomore, it was the fall, and I'm in statistics. So I have a very rudimentary understanding of how to analyze things. And so as I'm looking through the government analysis of restraint, seclusion, and corporal punishment data, I'm realizing that they did it very poorly. Even though
that's probably an understatement. I mean, while the data is available on their website, the way they display and share it's such a small slice of data that they're even making available in terms of what's easily accessible. I mean, you can certainly wade through those spreadsheets, but that data set is a challenge.
Definitely. And so even though I didn't understand that much statistics at the time, I knew enough to understand that the way that they had analyzed it and the way that they had presented it to the world was not very accurate. They kind of skewed it, or they would omit certain parts, or they would only show graphs that looked good for the government. And so I realized, okay, I would like to analyze this data properly. I want to take classes for statistics. I want to take classes for data analysis, and then I want to analyze this data properly. And so that's how I realized that I wanted this to be my research project. And then over the next few years, I learned how to properly sort through the spreadsheets. I met with the UT Austin statistician. I met with Dr. Marinelli, and then I was able to properly analyze it and then write it into the research paper that we have now.
That's great. Yeah, I have shared frustrations about that data set for quite some time. And in fact, if you went back a number of years ago, um, their web version of the data today, as you kind of identified, is really lacking. If you went back a number of years ago, they actually provided more data on the website several years ago, and at some point it seems like they tried to make it more visual, and in making it more visual they narrowed what they were showing. And there's like one data point that they show related to restraint seclusion, yet they have this really robust data set that has a tremendous amount of information. And that's been a subject for me that has been one that has concerned me for quite some time, because it's really hard to go through. I mean, it's almost making the data inaccessible when you only have it in, a comma separated value spreadsheet, and it's not easy to navigate. And in fact, we have a project we've been working on to try to make that data more accessible. And there's a lot to it. I mean, you can look at the data, by state, by school district, by individual school. You can look at the number of instances, the number of people that were restrained and secluded. You can look at race, you can look at disability. There's so much more, but it's all hidden in that spreadsheet. And the spreadsheet, there are challenges with. I mean, it is not your cleanest, most normalized data. There are codes in the spreadsheet where they've used negative numbers, which suddenly cause problems when you're trying to do some data analysis, and you were like, oh, -7, that's a code that means something. Oh, well, why is that in the middle of this data? So it really is a challenge. So as you begun to look at the data, and again, I mean, you pointed out, I mean, you needed some more background to be able to do this. And at one point, I reached out to the Department of Education, which this is where the Office of Civil Rights is housed, and I shared concerns about the difficulty in kind of accessing this data. And someone there that I had been in contact with sent me kind of like, oh, here's how you figure it out. Here's the codes that you need to know and how you can clean it up. And, over the years, I've had journalists that have reached out to me trying to make sense of the data. I'm like, okay, it takes some time. It takes some time to figure it out and be able to go through it. So once you started to do that, once you got sufficient, kind of background in looking at data and statistics, what did you begin to see as you started looking at the data?
So the first thing that I did was I tried to isolate it by variable. As you mentioned, you can look at school district, you can look at race, you can look at gender, you can look at political affiliation. And so I wanted to isolate it by variable. And what I ended up finding was that there were 4 groups that were most likely to be subjected to restraint, seclusion, and corporal punishment. And that is African American students or students of 2 or more races, male students, students who live in a Republican state, not necessarily students who are Republican, but students who live in a Republican state. So for example, I live in Texas, I would fall under that. And then students with a disability. So I did a chi-square, which is a statistical test. And looking through this data, I want to say I did 48 chi-squares, and all of them were significant. And I ended up finding that those 4 groups were significantly more likely, based on this data from the CRDC, to be subjected to restraint, seclusion, and corporal punishment. Wow.
Yeah, it's interesting because there was actually a piece of the data or a view of this data that I hadn't considered before or looked at before. I've long known from the data that I've seen and the analysis that I've seen that, children with disabilities, Black and brown kids, far more likely. But the idea that whether you were in a Republican or Democratic state made a difference, that was actually kind of surprising to me. And I guess, and again, you can look at the map and sometimes find that certain policies are more likely depending on what kind of state you're in. But that was a little surprising to me.
Yeah, definitely. I think I kind of anticipated happening. What I didn't anticipate was how strong it would be. It was extremely significant. And what was very surprising was there were a few states that were definitely skewing it, specifically Texas and Mississippi. I don't know if they have certain laws, they probably do, but those 2 Republican states would really skew it. And then when you think about education, it's on a statewide level.
Right.
And so a lot of this restraint, seclusion, and corporal punishment laws are on a statewide level. And so because of that, Republican and Democratic states kind of tend to have a difference.
Yeah, it's interesting because, when it comes to restraint seclusion, specifically, there are federal laws around the use of restraint and seclusion in law enforcement, in medical and healthcare settings. There is no federal law currently around the use of restraint and seclusion in schools around the nation. And Lauren, as you pointed out, what that means is every state is on their own in terms of what their laws and policies say. And they vary considerably as you look across the country. Now, one of the things that you likely reveal in your data is that when you look at these issues, you look at the disproportionality as it may impact disability and race. There are underlying civil rights issues. There are underlying disability rights issues there as well. I've long contended and will continue to advocate for the fact that this is a civil rights issue, a human rights issue, a disability rights issue. And I don't believe that those, I believe there should be federal law. I don't believe that those rights should vary as you go from state to state. And when we look at something like restraint and seclusion, it clearly shows that this is an issue that, affects certain children in a way, much greater rate than others. So I think that's really interesting that you kind of pointed that out.
Yeah, I definitely agree with you. I think it should be on a state-by-state level. I think there are some things in education. Sorry, I agree with you that it should be on a federal level and not on a state-by-state level. I think there are certain things in education that they can allow the state to take care of, statewide colleges, all of that kind of stuff.
Sure.
Civil rights should not be one of those.
I agree with you 100%. Yeah. I mean, I'm perfectly fine to support states' rights in certain areas, but I think anytime it infringes upon civil rights and human rights and disability rights, then I think there have to be federal protections in place, and there are none. And not that there hasn't been an effort to do so. I mean, you go back, and I'm sure you know this. I mean, you go back to 2009 after the Government Accountability Office did a report titled Seclusion and Restraint, Selected Instances of Death and Abuse in Public and Private Schools and Treatment Centers. There was an effort to pass federal law going back to 2009. And there has been an effort to pass federal law almost every year since. We've got a current bill called the Keeping All Students Safe Act. That's proposed federal legislation that, if passed, would prohibit seclusion, prohibit prone and supine restraint, prohibit mechanical restraint. It would add funding to allow schools and districts to move away from these practices. But, to this point, we've not been successful in getting federal law in these areas. And, I think that's unfortunate because, again, I mean, even looking at when the Department of Justice goes in and they investigate these issues, time and time again, what they find is that there's violations of, civil rights issues, and these things are really concerning. I pulled up a copy of your full paper here, and you've got a lot here. I wanted to talk a little bit, kind of going through a little bit of your research. I know you began by doing a literature review, just kind of setting the stage. Tell me a little bit about that. When you began doing the research for this, what were the things that you were looking at, and what were you finding aside from the data set itself? What were some of the things that you were finding when you began to kind of set the stage for doing this research?
Definitely. So the first thing that I wanted to learn was just what are the basic definitions for restraint, seclusion, or corporal punishment? What is it, and how does it happen in schools? The second thing that I wanted to look at is how it happens in psychiatric facilities versus schools. So as you'd mentioned before, there are regulations for medical institutions, but there are not for schools. And that's also a pattern that we see in terms of the research. So there is quite a bit of restraint seclusion research for psychiatric facilities, but the research is quite lacking in the schools. So that's the second thing that I noticed when I was performing my literature review. If I went onto Google Scholar, or if I went to PubMed and I searched restraint and seclusion, everything that popped up would be psychiatric facilities. I would then have to also put schools if I actually wanted something for schools. And then the research would be much less. The second thing that I was looking at was government regulation, which again, you just explained. What government regulation is there on restraint, seclusion, and corporal punishment? What's the history of it? And then lastly, I was looking at the data set that I collected from the CRDC. What is the current research that they have? What kind of analysis did they do? What kind of analysis do I want to do that's going to be different? And what do they have published online? They have an article where they analyze the data that I used 2017 to 2018. And the CRDC basically goes through all of that data that they have, and they kind of give a very small research and data analysis. And that's also something that I kind of talked about in my literature review.
And I wonder if you can tell me the data set that you use. Why did you use that data set versus maybe a more recent data set?
So the data set that I used was 2017 to 2018. The next data set is 2020 to 2021. And pending, it will come out soon, but it hadn't come out when I was performing my literature review and writing my thesis, 2023 to 2024, I believe. So 2023 to 2024 hadn't come out yet, so I wasn't able to use that. And then 2020 to 2021, I considered using it. However, it was during COVID and a lot of people were at home. The data set wasn't as good as it would have been. And so because of that, I ended up using the most recent one that I could, which was 2017 to 2018.
Yeah, yeah. You know, this was one of my other grievances with the Office of Civil Rights data is it is often a matter of 3 to 5 years before data becomes available. And, you know, I would imagine you and I would agree that data needs to be accurate. It needs to be timely. It needs to be relevant, you know, for data to be useful. And, you know, when you're lagging 3 to 5 years before you get these data sets out there, it's really difficult. And I've always been really frustrated that it takes so long to get that data in and normalized. And of course, there are issues, historical issues with that data as well that continue, which is there's a tremendous, and I'm curious if you found anything about this in your research, but there's a tremendous under-reporting that happens. In fact, in 2019, the Government Accountability Office kind of sent some very strongly worded guidance to the Department of Education and said, you've got problems here with your data. We know that there are entire districts that are reporting zeros when in fact that's not accurate. And you know, they really called out Ed on and said, we've got to do something about this data. So what did you find in that in terms of the data? Did you find any of the concerns related to underreporting? I mean, I've always looked at that OCR data set as it's the best we have, but I would venture a guess, and I'll substantiate this in a moment, but I would venture to guess it is probably orders of magnitude off, that it's not truly an accurate representation of what we're seeing going on. What did you find as you kind of dug into that as you were looking into this data?
I would 100% agree with that. There were a lot of states that would just report zero, and then there were a lot of states that would report so many. And at first glance, it's like, all right, well, Texas clearly has a problem where we're reporting so much restraint and seclusion. But then you have to think, is it really that Texas has more restraint and seclusion, or are they the only ones that are reporting? Because so many states actually have zero, and I find it very hard to believe that those states actually have zero. So the first thing is, yes, there's underreporting, and then there's also just states reporting zero as a whole. And I think that definitely affects the data. And I think underreporting is something that occurs across the board. And when you're analyzing data, sometimes you have to kind of accept, okay, this is going to be a confounding variable. If one state is underreporting, we're just going to have to assume that everything is underreporting and factor that into the analysis and accept it as a confounding variable. Another thing that I kind of want to mention about the time, about the CRDC publishing the data so late, especially in this country, political climate is constantly changing. We had the political climate in 2017. It was right after the 2016 election. That's very different from how we are today. We've had many different politicians come into place. At that point, President Trump was president, and then Biden, and then Trump again. So just them taking so long, it really affects the political climate and affects the situation in which this data is also collected.
Yeah, good points, good points. Yeah, I mean, the data definitely has been problematic. I think back to when this first was an issue that I began looking at, and very early on when I started advocating for change locally, I found OCR data and actually then found Maryland data. And this would have been in the, probably December of 2018. And I remember looking at the federal data that was available and looking at the Maryland data. And what was really interesting to me, and my numbers aren't going to be exact here, but the number of instances reported in the data that I saw on the federal level was like, 125,000 restraints and, 100,000, something like that. And then I looked at the Maryland data and found that there was like 28,000 instances of restraint and seclusion combined. Now, given that there's 50 states, you'd have to believe that Maryland was making up like a large portion of the federal data. And that's just not simply the case. But the question was, like, why is the Maryland specific data different from the federal data? Now, of course, states may have different definitions than the federal government, right?
Yes.
And that's problematic, because how do you count something that doesn't exist? So if you define seclusion differently than the federal government defines seclusion, are you recording seclusion according to the federal standard and according to your own standard? How do you do that? How do you manage that? And I actually found out locally when I began looking at this, they had different data sets. They had a different data set that they reported to the federal government and one that they reported to the state. And the chance of error there just seems to go up astronomically. But data definitely has been an issue. And if you talk to parents of children that have been restrained and secluded in schools, it's not unusual to hear stories of underreporting. And I can attest to that myself, where for every one instance that you know about, it seems like there's often many that don't get reported. So, that definitely is a big issue. But nonetheless, you do end up with data, and that data can be helpful to get an understanding of, the who and what's happening here. And of course, that's what you found, is that, there were certain children that were far more likely to have these things happen to them. So you talked a little bit about your, your methods, and how long did it really take you to kind of get that, narrowed down? Again, I've waded through that data set before. It's not a fun data set to work with. Tell me more about that process and how you kind of worked through that data, and then, figured out how you could use it in the analysis you were doing.
Yeah, definitely. So at first glance, I realized, okay, there are so many different variables. And in my statistics class, I learned about isolating populations based on variables. And so I have the whole US population. I'm not going to look at disability, race, gender, and political affiliation of the state all at once. Instead, I realized, okay, we're going to take bite-sized increment. The first thing I want to look at is disability versus non-disability. That's only two groups. It's easier to distinguish between those two. And so once I just decided on the variables that I was going to do, it became much easier. And so the first thing I did was I did 4 total experiments. The first one where I only looked at disability, the second one where I only looked at race, the third one where I only looked at gender, and then where I only did political affiliation. And deciding to only do a few variables made it significantly easier, because I was able to isolate it only to certain spreadsheets. And so after that, after I decided to do only specific variables, I also decided to only do specific states. So there is data where you can look at, okay, within a state, each county, which one has the most restrained seclusion. I opted to instead do the one just for the state, because if you're looking at disability versus non-disability, we're looking at it at a national level. We're not going to be looking at the individual counties. And so deciding to only do the state also made it easier to wade through the data. And then after that, I had the spreadsheets, and I was able to group it into students who had a disability and experienced a restraint, students who did not have a disability and experienced a restraint. And the biggest thing that I did that the CRDC didn't do is I tried to compare it to the total population. So when you first look at it, and I think about 70% of the restraints are students with a disability. And that seems extremely high. But then you have to remember, okay, how many students actually have a disability? Compared to the students without a disability, it's very low. So you have to divide the total amount of students who had a restraint with a disability by the total population of the students with a disability. You can't look at it as 70-30. You have to actually say, no, what percentage of the students with the disability population experience a restraint? What population of the students without a disability population experienced the restraint? And then once I had those numbers, I was able to perform a chi-square based on those. And so that was basically what I did for the first 4 experiments. And then after that, I was able to look at multiple variables at once, looking only at the male population. How is the political affiliation different? Looking only at the female population, how is the political affiliation difference? And so basically doing it little by little, and also looking at the percentage of the population that experienced a restraint and seclusion, those two were very much able to help me.
Mm-hmm. Yeah. And again, you kind of point out that these are things that aren't being done with the day-to-day.
Yeah.
And for anybody that hasn't gone and looked at it, the OCR data site is available, and you can drill down into the school districts. They have a tremendous amount of data that's captured through these surveys, but there's a very small slice of it that they show in relation to any given topic. So, for restraint seclusion, I think there's I think it's a race metric, but they don't say how many instances of restraint or seclusion happen. They used to show that, a number of years ago, they would show the instance count. They no longer show the instance count. It's one piece of data, and it really, in isolation, isn't very meaningful. So there's definitely a lot of room for changes there. And again, I think, given the tools that we have and the technology we have today, it seems like that should be something that would be a really high priority, because, to understand this data can help us come up with better solutions and ways of moving away from it. Talk to me as you did this research. And again, you had some background going into this. So you had done some research on restraint and seclusion as a whole. You've been working in Dr. Marinelli's lab. You had this interest. What surprised you? Was there anything that surprised you about the process, about the data, about the findings? What surprised you as you were doing this research?
So a few things surprised me. The first one is I knew that I was going to find statistically significant things. I did not expect every single test that I did to be statistically significant. I thought there would be at least one that was not statistically significant. Everything was. That's the first thing that surprised me. The second thing that surprised me is I truly didn't realize what the difference was between the two groups. Yes, I knew there was a difference between disability, and I knew there was a difference among race. I didn't expect it to be so extreme. In my statistics class, when we would look at chi-square, the chi-square value, the higher it is, the more statistically significant it was. And when we were doing exams, the chi-square value would be like 70, it would be like 10. If something rarely would reach to actually 100. When I was doing it, it was in the millions. Sometimes it would be multiple tens of millions. I was completely shocked by that. And whenever I was looking at it, I would do it multiple times. I was like, there's no way it could be this high. I didn't expect the difference to be so high. And then the third thing was, I truly didn't expect the difference between Democratic and Republican states to actually be statistically significant. I knew that there was no federal legislation, but I didn't realize that letting the states handle it would be enough that it would become statistically significant.
Mm-hmm. Yeah, I mean, it really is interesting. And I will tell you that, things don't always follow the pattern that I think they're going to follow. But, when you look at laws, there are differences, definitely, as you look across kind of the political landscape of various states. And for instance, you are more likely to see corporal punishment, in certain states. And we only allow it. I mean, it's in public schools, I think 17 states still allow corporal punishment. So it's not the majority of states any longer, but certainly we see those things. But sometimes things surprise me. I was actually having a conversation earlier today with someone in New Jersey, and we were looking at their restraint and seclusion law. And it's a much weaker law than I would expect, given what I know about New Jersey. So these things don't always follow kind of the expectations that you might have. But it's interesting to me how significant that showed to be in the research that you were doing. So, once you completed this research and you had your findings and, you began, sharing your paper, I'm just kind of curious, what kind of feedback did you get as people that may not have been familiar with the topic began to dive into reviewing your paper and offering any feedback or thoughts that they had?
So the first thing that happened when I was presenting it at the honors thesis symposium, someone raised their hand and they were like, can you just clarify what corporal punishment is? And I explained to them the definition again, which is when you use violence against children in schools. And then they're like, no, I don't think we beat kids anymore. And I was like, well, here's the data to show that it's still allowed in many states. And that was basically what people were reacting to mine is, it's crazy that this is actually so statistically significant. Are you sure you didn't make some sort of mistake? Mm-hmm. So the biggest thing that people have been reacting to my paper is just overwhelming shock that this is still allowed, overwhelming shock that this still happens, because a lot of people, when they go through the school system, you don't actually see restraint and seclusion and corporal punishment with your eyes. And so people were mostly just very surprised at all of this data and all of this research that I had done.
Yeah. It's interesting because, having been working on this now for many years, I often hear the same response. And it's interesting because you sometimes hear the response like, oh, we don't do that in my state, or that's not allowed here. And it's like, where are you from? Oh, yes, it is. People often know. And often if they don't see it, it doesn't exist. Right. But, when you look at the way that these things affect certain children more than others, there's a reason that a lot of people sometimes don't see it. One of the things that we found is, in addition to, being more likely to be restrained or secluded if you are a child with a disability, if you are a Black or brown child, if you are a very young child. Additionally, one of the things that we find is if you are in a more restricted placement, you are more likely to be restrained or secluded. So for example, as you move from a general education classroom setting in a typical public school to a segregated setting, like a special education classroom, those children that have moved into that special education classroom more likely to find themselves being restrained or secluded. Children that move into separate, like special education day schools, more likely to find themselves being restrained and secluded. So sometimes these are happening to certain kids, and you may not see this, but it doesn't mean that it's not happening. One of the things that we often see looking at data is, and I'm curious if you had any analysis in this area, but if you look across a given state, you will find that there are certain school districts where these things happen much more than others. Did you find anything that correlated with that?
So I didn't do analysis within the state. I would briefly look at it, but I wouldn't say I'm qualified enough to speak on the statistical significance. The only thing I can say is whenever I would glance at the state data, there were places where so many of it was zero, and then there were places where it was clear that this was a reporting district. And so I want to say that it would most likely occur in rural areas just because of the socioeconomic background, but I don't know if I'm qualified enough to say because my research was mostly on a state level.
Sure. Yeah, I mean, it's something that we often see when we're looking at data is there are, even within a state, you may find that there are certain districts. I'll give you an example. So, when I first began this journey, it happened because of my son. My son was being restrained and secluded. And we had 23 school districts in the state of Maryland. My district was not one of the biggest. It was not one of the smallest either, but it was probably somewhere in the middle. We were a little bit more of a rural district. And turns out that my district at the time was number one in the state in the use of seclusion, number two in the state in the use of restraint. So they were doing these things at a far greater rate than others around the state. There was another district in Maryland, Frederick County, and they eventually actually got investigated by the Department of Justice. They were number one in restraint, number two in seclusion. So kind of our flip side there. Mm-hmm. So, I mean, as I've looked at data before, we often find that there are places, hotspots. There are places where it happens more than other places. And, I think there's some explanation for that. And it sometimes comes down to culture, it comes down to training, it comes down to, how people are told to respond when there are certain situations happening. One of the things that, in addition to having laws that are sometimes not as strong as they should be, very often at the end of the day, the staff that are working directly with kids sometimes don't really understand what the law says. And as a result, you find these things being applied when they shouldn't, even according to what the state law might say, because people have a misunderstanding of when these things might be appropriate. So there's a lot of this that happens in ways that probably are not even consistent with what the state laws around the state say. So it's kind of interesting. So as you did this research and you kind of had your findings, what would be your hope for how this research might be helpful to others that are interested in this topic? So how do you think this might be helpful to others that are looking into these things?
So the first thing that I hope my research does is I just hope it educates people. I hope that people are able to look at it and at least read the introduction, understand what restraint, seclusion, and corporal punishment is, and just be able to get educated on the topic and how it impacts our society. The second thing that I would want is I would want some sort of national regulation, especially when I looked at the difference between the Democratic states and the Republican states, as well as the difference between different demographics. There shouldn't be a difference between race. There shouldn't be just a difference between disability, non-disability, and gender. Because this is clearly a civil rights issue that happens on a national level between different states, I would want some sort of national regulation. So those are the two main things that I would want to come from my thesis. One, I would just like people to get educated from reading it, learn more, hopefully learn more about restraint, seclusion, and corporal punishment. And two, I would want some sort of national regulation.
Mm-hmm. And what about future research? This is a snapshot of a set of data. What additional research might be helpful in this area? So for others out there, and I thought it was great when we were talking before the show, and you mentioned how, you'd seen a couple of the podcasts before you actually, were doing this work, and how students would watch a couple of the podcasts as well, which is great. But for a student at UT that might be watching this podcast and thinking about kind of like, what would you suggest to them? Like, what are areas that would be really helpful in terms of doing future research?
So the first thing is, I did this research on 2017 to 2018. Once the new data comes out, it would be so interesting to do this exact same project on the new data and then compare 2017 data to 2023 or whenever the new data is. That's the first thing that would be so interesting. The second thing is, I did 4 different variables and I did a combination of the variables, but you could go even deeper. So I separated the population, like for example, in one of them, I separated it into male and then into female. And then within the male students, I only looked at race. And then within the female students, I only looked at race. And I would like to separate it even more. I would like to separate into male and female and then look at, okay, male students with a disability, how does race come? Male students without a disability, how does race come? So you can go even more in depth into the variables. And then the last thing is, as we've talked about the different school districts, it would be very, very interesting to look at the different school districts and how restraint, seclusion, and corporal punishment changes based on demographics within the school districts. That last one is probably going to be a little bit more intensive than the other ones, just because the other ones are on a state by state level, and there's only 50 states, and there's significantly more school districts. But I think those would be some very interesting future directions I would like to take with this data and just restraint seclusion research looking at populations.
Mm-hmm. And given the way that this kind of research works, you've got your methods, and so it wouldn't necessarily be, I don't want to say it wouldn't be challenging, but you've laid out how you did this research. So for somebody to follow in your footsteps and to look at a future data set, they've got a roadmap here, right? I mean, this would really help them if they decided to move forward on that. And they might save some time and some of the frustration you had as you were trying to figure all this out. So, I mean, that's the point of doing research like this, is creating a map that others can follow. Others can look at your data and verify your data. Others can come behind you and look at other data sets. So it seems like you've created something that would be really advantageous to others that might be interested in it. Would you agree with that?
Definitely. And I certainly hope more people get interested in restraint and seclusion research in schools. It's something that needs to happen. And the more research, the better, because as we continue to do this, we build awareness and we just understand more about the topic as a whole, why it happens and what we can do to prevent it.
Yeah, no, I love that. And for us at the Alliance, we've been doing some internships now for a while. In fact, with the work we've done with UT, it really is because of you. You had reached out and we connected and had a conversation, and I had known of Dr. Marinelli, and you kind of created that, and we had others that we work with, Anjana as well there at UT, and that's going to continue on. We've also done some internships with the St. Louis University. We work with a couple of other colleges as well. I'm a really big proponent of supporting that research and the student work that's being done out there. And part of the reason I actually wanted to have you on here is, this is really incredible. And I had the privilege of working with you for these 2 years. And, I want to highlight this amazing work that you did and encourage others to do this as well. I had another student reach out probably a month or so ago, that had found some of our work during some research that they were doing and became very inspired and ended up writing a couple of research-oriented papers on restorative approaches. And we published those. We absolutely want to share and amplify, the great things that people are doing, especially the great things that students are doing, because that research, there's a gap. There's a need for some of this out there. And so I really appreciate you and the research that you've done. I want to give folks that are watching live. So if you're watching live, and I see a couple comments here, and I'll try to get these in a second. If you are watching live and you have a question or a comment for Lauren, please feel free to put that in the chat. I think it's really, as I was saying, really important to, highlight this work that's being done. And again, Lauren, really appreciate you and your dedication to this, because I know how hard you were working. As I read your bio, it's not like you had a lot of extra time just to devote to a lot of different priorities, but really appreciate you doing this. So let me get to the comments here. Sarah Johnson-Wall said, yes to more research. Absolutely agree. Yeah, we absolutely need to do that as well. I've got another comment here. I've not really read this, but I'll look at it here. Belinda said, I remember when mine was a kid and they kept sending me forms assigned for services. And it had a bit in the forms, governor, do these. Okay, I kept sending back, telling them to take this out, and then I would sign it. They kept sending it back to me with nothing removed. Called for a meeting and asked to take it out. And I'm assuming that's something related to restraint and seclusion. Sometimes in some states, they would put it in as parental consent, and they would kind of push parents into signing things to say that they agreed to the use of restraint and seclusion, which, of course, even if the parent did, doesn't change what the laws are that govern the use of restraint and seclusion. So even if a parent says, okay, well, I agree to that, and I don't necessarily recommend that you do that, it doesn't change the fact that if the laws say this is the only time you can do these things, those are the only time you can do those things. So thinking back to your time at UT, and you were in Dr. Marinelli's lab, kind of neuroscience focused as well. So I'm just kind of curious, one of the things that we focus on a lot here at the Alliance is, how do we move people away from, restraint, seclusion, corporal punishment? It's one thing to look at the data and realize what's happening. It's another to, as we dove into that research about impact, understand the harm that's caused. The third piece of it then becomes, well, how do we get people moving in a better direction? How do we move them away from, restraint, seclusion, suspension, expulsion, corporal punishment, all of these things? And, at the Alliance, we often talk about kind of our principles, which are what we believe is what's necessary. We move in directions that are trauma-informed. We bring in this neuroscience. So I'm always a huge believer in the importance of neuroscience when it comes to how we see and respond to human behavior. I'm just kind of curious, from your experience and your interest, kind of in the neuroscience part of this, if there was any relationship. Obviously, you were looking at data here, but if you see any connection between the neuroscience and, kind of what you were researching around restraint and seclusion.
Yeah, I don't know if I'm qualified enough to speak on the neuroscience. I don't know that much about it, but I can definitely agree with you that public awareness is a very important thing for restraint and seclusion, and that if we're trying to move away from public awareness, if we're trying to move away from restraint and seclusion, public awareness is a very big pillar that we need to be focusing on. In terms of neuroscience, in our lab, we would mostly focus on population data and literature reviews of existing data. We didn't focus as much on the neuroscience, but I think it would definitely be something that's worth looking into. How does restraint and seclusion impact the neuroscience people? How does understanding neuroscience fit in with restraint and seclusion? Definitely something to look into, and definitely something to understand.
Yeah. Well, of course, there's been an explosion in research around neuroscience since the 1990s. The 1990s kind of called the decade of the brain, and that led to a lot of research. And of course, prior to that, there was a growing body of research around the impacts of trauma and how trauma affect the brain, and the connection between those things is really strong. And I think when you begin to look at why restraint and seclusion happen, and that's a piece of this that, the data doesn't cover. The data doesn't tell you why it's happening. It tells you who it's happening to and how often it's happening and all of those things. But when you really dive into the why it's happening, I can share with you from our work that, why it happens is because, we have kind of approaches and ideas around behavior that are not working. A lot of what we're doing in schools around behavior is not working. If it was working, we probably wouldn't end up in situations where kids were being restrained and secluded. But a lot of the ideas around behavior are still very rooted in kind of classical behaviorism, classical, operant conditioning, reward and consequence models. And, a lot of these things are not working. But that to me is a really interesting area, because when you begin to understand that, yes, there's a problem, the question then has to be, how do we move away from this? And this is where we put a lot of our focus, is trying to figure out what we can do instead, to really better support not only the students that these things are happening to, but, also eventually the teachers and staff and the communities as well.
Yeah, whenever we would present our research at UT, whether you're presenting a poster or doing some sort of slide deck, the most common thing that people would come up to me and say is, I'm a teacher, I work in a special education department. What else are we supposed to do?
Right,
And I
right.
think just educating people and understanding the alternatives to restraint and seclusion is so important to move away. Instead of, we can't just say cold turkey, we're not going to do this anymore. It has to be a boots on the ground situation. We have to educate the teachers. We have to work directly with the teachers for there to actually be some sort of change. At the end of the day, the politicians are not the ones interacting directly with the students, it's the teachers. And if we want to move away from restraint and seclusion, working directly with the teachers is so important.
Oh, absolutely. Having been working on this for some time, we've always focused on the idea that, yes, law and policies are really important. Getting better laws and policies is really important. But a better law or policy without getting to people the better approaches, the better things that we can and should do to ultimately move away from restraint, seclusion, suspension, expulsion, corporal punishment, without focusing on that, you're never going to get the solutions that you really want. Because you can introduce a better law that restricts something, but without giving people, how do we better support these children? We're not going to get where we need to get. And sometimes there's unintended consequences. You have a stronger law that maybe prohibits something, but in the process, you see an increase in something else that's not desirable. So, if you prohibit seclusion, then find out that you're increasing, law enforcement referrals. Well, that's not what we want. But I do believe really strongly that there are better things that we can do, that there are better ways of supporting children, teachers, and staff to move away from these practices. And when you can focus on that, you can do amazing work. You mentioned in the beginning kind of some of the research around psychiatric facilities and other areas that had more research. What I found very interesting before is that there's been some really significant work around reducing restraint, eliminating seclusion in acute psychiatric facilities, for instance.
Yeah.
And it's really hard for me to believe that you can reduce and get rid of practices in an acute psychiatric facility, yet you need it in an elementary school. So I think that to me, it's always spoken volumes that, well, if we can do it there, we can do it here. And you can. I mean, there are lots of places that have, and we have entire states now that prohibit seclusion, for instance. Or certain types of restraint. So absolutely it can be done. But if you're an educator and don't know what else to do, it's really tough because, what else can you do if you don't have any other tools or any other ideas of how you can change things. I have a comment here real quick I just want to get to. Families and educators against restraint and seclusion. The use of minimizing language like blue rooms, break rooms, and sensory spaces allows school administrators to hide their use of seclusion and confinement of children from parents and communities. Really great point. And of course, in this data set, it doesn't necessarily go into that, but one of the things that we found, and I don't remember if this came up in the research, it probably did, but one of the things that we often find is that, where seclusion is a practice, they don't call it the seclusion room. They call it the blue room, the cool room, the break room, the regulation station, whatever they may call it. And the important fact is that it doesn't matter what you call the room, it matters how it's used. So if it meets the definition of seclusion, it's a seclusion room.
Exactly.
And should be counted as seclusion. But the relationship here, though, is that when people use that kind of language, one, the parents and families don't necessarily understand what's happening. But two, they may be less inclined to report it because, we didn't seclude them. We took them into the blue room. Well, were they in there against their will and not able to come out? Well, yes. Well, then it was seclusion. So it could lead to, potential ideas that could lead to underreporting as well.
Yeah. And then even with underreporting, if you have some sort of law that says, all right, you need to report every single instance of restraint and seclusion, the politicians are not in the classroom. They're not looking over the teacher's shoulder saying, okay,
Right.
Did you report that? Did you report this? And then there's also discrepancies in language, like how you mentioned before. But if you have one student and you restrain them 5 times in a day, do you report it as once or do you report it as 5 times?
Right.
And so all of these little differences contributes to the discrepancy in reporting as well. And really, sometimes it needs to be on a sometimes it's on a district by district level, which leads to so many more issues in terms of, okay, does this district really have more restraint seclusion, or are their reporting policies just better? because this district over here has 0 restraint and seclusion. Is it true that they're actually a better district, or is their reporting policy just not as good?
Right.
So looking into reporting is so important when understanding restraint and seclusion.
Yeah, absolutely, absolutely, and we see that. I mean, we see that in practice. I remember hearing that from my own school district, as a matter of fact, when I was bringing, kind of the point that they had the highest rates in the state, and they said, "Well, we think we're doing a better job of reporting." I happen to know firsthand that there was a bunch of underreporting that I saw in my own situation, so I was a little skeptical of that. So I guess more than one thing can be true here. It's like you can be doing a better job reporting, but it doesn't mean that you're always doing, the best job that you can do reporting. And at the end of the day, I mean, a lot of this comes down to, training and making sure that people are aware of what the laws say. And again, we've talked about this definition issue earlier, but it's really tough. If you're supposed to be, there's a requirement to report this federal data. There's a requirement for every state to report this data to the Office of Civil Rights, the data that you're reporting. So they're required to collect and report that. Many states have their own internal reporting processes as well. And when the state and the federal government define terms differently, it puts a big barrier up with how you collect data, because are you using this definition? Are you using this definition? Or do you have 2 different data sets that you're collecting data for? So there's a lot of problems that can go into this data collection as well.
Yeah, and it's also just adding more work to the teachers' plates. And because of that, at the end of the day, if they're supposed to report all their restraints and seclusion, and they have 2 different data sets that they need to report it to, they might get confused, or they might just not report it because they've been working for 10 hours and they just want to go home.
Right. No, absolutely. I mean, there is increasingly more and more on educators' plates, and this is not, necessarily an educator issue per se, but there certainly is an issue, that I've seen, at least, that very often, the educators in the classroom are not appropriately staffed, not appropriately trained. And as a result, these things sometimes happen where they really are avoidable. And, if you look at the impact of physical restraint and seclusion, and of course, this data set doesn't cover any of this, but there have been deaths due to the use of physical restraint in schools. There have been deaths even related to seclusion as well. Knowing that there have been deaths related to this, it's a serious issue. I mean, it's not like just any other school policy. It's one that, if what you're doing could be causing great harm.
Yeah, 100%. And because of that, it should be taken very seriously. There should be national regulation on it. If it can harm students, there should be national regulation on it to protect students and just for the overall safety of schools.
Yeah. So again, really, over the last, 2 years or so, really appreciate all the work that you've done in this area. And, now you're getting ready to start a whole new chapter and going into medical school. Tell me more about what's next for you, where you're headed. And I'd love to hear if you think that this work that you did will have in any way inform work that you might do in the future.
Well, thank you. I've truly enjoyed working with the Alliance over the past few years. I've enjoyed working on restraint and seclusion research. In the future, I'm going to be doing potentially more research, but I'm going to be trying to focus more on my academic career. As I start med school, my workload will be a lot higher. And in the future, I just really hope that more restraint and seclusion research is done.
Yeah, no, I hear you. And that research can make such a big difference in, how we understand and it can be what makes the difference in getting better laws and policies in place. And so, again, want to encourage, student researchers as well. I think there's so much potential, for the work that you're doing. And I love when I get an email from somebody that, we have a professor out in California who so the students that she has in her classes, she has an assignment where they participate in one of our book studies, right? I love that. I love, kind of, bringing this into people's world so they can kind of understand, some of the challenges that are out there. And, these are people that will hopefully help inform better laws and policies and whatnot in the future as well. So I love this opportunity to do this. I will open it up one last time for any questions or comments. We'll be wrapping up here in just a couple of minutes. But if you have a question or comment, feel free to put this in the chat. I do want to just again remind you that, and we've shared the link a couple of times here, but the link to the entire paper is available on our website. We'll also provide that link for you as well. We also have a kind of a shorter article as well on the website. And if you go to our website and kind of go to where the articles are, there's kind of a shorter piece that talks a little bit about it at a high level and then links back to the article. And I think we've published enough articles. There it is there, leveling the playing field. So I encourage you to check out the website. There's kind of a nice summary here of who's more at risk, kind of looking at those factors you talked about, how race, gender, political affiliation of the state, how all of those things factor in, why this is so important for the advocacy work out there. And of course, you have your recommendations here that you've shared with us about, more restrictions and stronger protections. And of course, people can come here and there's a link to the full research paper as well. So encourage you to check that out if you want to learn more about this. Lauren, I really, again, appreciate all that you've done over the last couple of years as you've been a intern here at the Alliance and the work that you've been doing at the university. It's been really great to be able to collaborate with you. And I think this is really important research. So definitely want to just kind of thank you for all that you've contributed here, even as you go kind of the medical school in a new direction. These things will be found, and that's the whole point. My hope is somebody 2 years from now finds your paper and says, "Oh, it's time to look at that new data set," and realizes that in your methods you've spelled out what you did, how you did it, and somebody else can kind of come behind you and take a look at it as well. So as we wrap up here, is there anything we didn't talk about that you wanna highlight in terms of this work that you did?
I think we covered quite a bit of it. I think the last thing that I want to talk about is, in the end, the statistical significance that I got was very different from what the CRDC posted online. Yes, they posted there was a difference, but they didn't talk about statistical significance, and the discrepancy that they showed was much smaller than the very large discrepancy that I found between these groups. And so just in anything in life, when you're reading something, it's very important to think critically and say, okay, this is from the government. This is what they said. Is this actually true? Mm-hmm. How can I use my own intellect? And how can I analyze it for myself? So the last thing I want to talk about is just how different it was from what the CRDC posted, my conclusions versus theirs. And just in general, whenever you're looking at something, don't always take it point blank. Always for yourself and really try to see, okay, is this exactly how it's being presented to me?
Yeah, no, I love that. I think that's a really important point. And of course, I think the positive here on the CRDC data site is that raw data, that data is available. So, anyone here can go and download that data and look at the data. It takes a little bit of time to wrap your head around how it's set up and to understand how to navigate it, but it is available. And, with some of the tools out there today, there's some amazing things that you can do with data sets, and would encourage people to do that. And so if you're curious about it, go check it out and, download the data, take a look at it. You can even just kind of separate your state out if you want to, or look for your school or district if you want to as well. And it's not just restraint seclusion, it's a whole host of data around school discipline and other civil rights data that they collect there. So encourage people to do that. Well, this has been a great conversation. And again, really appreciate you joining me here today. I really wanted to have an opportunity to highlight this work that you did. I think it's amazing. And just, again, want to thank you for your time, your research that you did, and encourage others to follow what you've done here.
Well, thank you for having me. I've truly enjoyed working with the Alliance. The Alliance is doing great work. I believe in it strongly. Everything that you guys do with the Alliance is so wonderful, and it's been truly an honor to work with you and to talk with you today about my research. So
I appreciate that. I appreciate that. So we're going to let everybody go here. We're going to end the show. And Lauren, if you would hang around for one more second, I just want to catch you one time before I let you go. Okay. But everybody that joined us here today, I want to thank you for being here. Thank you for being part of the Alliance Against Seclusion and Restraint community. Encourage you, share this. If you know a student right now that's doing some research or looking for a topic to dig into, share this with them. If you know somebody that's over at the Office of Civil Rights, the data collection office, share that with them as well. I've reached out in the past and shared some of my thoughts, but it's helpful. It's helpful to share these things, and I think we can do better. I mean, this public data, again, it's great that we have it, but you've got to make it accessible. You've got to make it useful. You've got to make it usable, not just kind of tuck it away in a spreadsheet somewhere. So hopefully we'll see some changes at some point in the future. So we're going to go ahead and wrap up here and join us again. I think we're back next week as well because this was a special episode, and we will see you all again very soon. So thank you. Thank you, Lauren.
Thank you all.
Bye-bye.